All right. Good morning, everyone. My name is Jennifer Price. I am a psychologist, and I work for Marshall's Jones C. Edwards School of Medicine in the Department of Family and Community Health. I've been with Marshall for around 9 years now, and I see patients and teach residents in family medicine. And I also work with some of our divisions of Addiction Sciences program, which is how I was introduced to this echo. I've known Laura for several years, and we're kind of northern and southern counterparts in working with pregnant and parenting women with substance use disorder. Prior to coming to Marshall, I worked predominantly in forensic psychology, working with parents and children who were involved with the child welfare system, and really made the pivot to Marshall because of some of the innovative programs that they have going on that were solutions to some of the problems that we were seeing a lot in our office, with the predominant issue I made that change around 2016 being the opioid epidemic and the role that that was playing in emergency removals at the time. There's been a lot of changes in the child welfare system over the last 10 years. Some good things, some challenges that we've had in the state. This is a topic that is really important to me, but I also hope that it will be conversational. So if anyone does have a question, please enter that into the chat so that I can be kind of interrupted and we can talk about that as a group. And so we'll get started. This is important because child welfare involvement rarely happens once. And I'm sure as you reflect on cases that you've been involved in, there are certain families that have had multiple referrals before a case is actually open for services or taken to court. Also, you may have adult patients who had multiple episodes of child welfare involvement as a child. Many individuals experience repeated system contact across childhood and adulthood. Systems can be both protective and stressful, and understanding cumulative impact helps us to improve safety, engagement, and outcomes. I want to focus us all on our shared goals. So on this echo, we have professionals from all different backgrounds, and we may come at this issue from slightly different angles, but I know we all have in common that we care about child safety, family stability, long-term well-being of everyone involved in the child welfare system, and developing fair, ethical, and humane systems. So this talk today will not have throwing anyone under the bus. We all have our role in supporting these families. We all have common ground. Okay. So I want us to be able, by the end of this lecture, to describe how child welfare involvement can function as a traumatic exposure across the lifespan, to be able to explain how repeated system contact shapes stress responses, relationships, and help seeking over time, to be able to recognize trauma-related behaviors at different developmental stages that are often misinterpreted, especially those by adults. We'll spend a lot of time on that. And to be able to identify opportunities within any role to reduce harm and interrupt intergenerational cycles. Okay, so what we know, individuals with childhood CPS involvement are at increased risk of CPS involvement as adults. Youth who have experienced out-of-home placement specifically have higher rates of later child welfare involvement than peers without. Studies consistently find elevated risk for parenting challenges, poverty and housing instability, mental health concerns, substance use disorders, and early parenthood among individuals who had childhood CPS involvement. And intergenerational transmission of these behaviors is common, but not inevitable. In fact, most maltreated children do not go on to mistreat their own children. In terms of research that's been done on the topic, one study found that adolescents who'd experienced out-of-home care were significantly more likely to be involved with CPS as parents by the age of 25 compared to youth without those experiences. Foster care alumni with poorer mental health, lower economic stability and weaker social support were more likely to have children who were themselves placed in foster care. And child welfare involvement is associated with increased risk of intergenerational poverty, which itself contributes to future system involvement. Child welfare involvement often reflects not a single event, but a pattern of accumulated adversity across generations. And I think that those of us on the call that work directly with families can relate to that point, right? It does happen at times that there's a single incident that brings child welfare attention to a family. But for a lot of our families, particularly those that have repeated CPS involvement, there's a pattern of instability that goes on over time. So it's not, a lot of these kids are experiencing more than one risk factor at a time. Trauma reactions are about loss of control. So the things that are involved with child welfare cases, particularly with removal and escalation to court cases, often involve sudden decisions, unclear timelines, parents having limited voice in outcomes, and high stakes with little predictability. So even though these interventions are necessary to protect the safety of children, these can still be experienced as traumatic by both parents and children, even when it may be in their best interests. Some sources of trauma that can occur in child welfare cases, just investigations themselves, being questioned about one's family, parenting, or safety can be experienced as stressful and frightening, even when concerns are not substantiated. Surveillance, which can happen with ongoing monitoring or observation, can create a sense of constant evaluation, which increases anxiety and reduces trust over time. And this may be surveillance not only from CPS, but family members who provided information to CPS. Family separation. Sudden separation from caregivers, siblings, or home can disrupt attachment and create lasting feelings of loss and insecurity. Placement instability. This is a factor that can happen after removal. Multiple moves or changing caregivers increases uncertainty and can make it difficult to form stable, trusting relationships. One thing that we know from research is that independent of other risk factors, the number of moves the child in care experiences is directly related to adverse outcomes. Court involvement. Legal proceedings can feel confusing and intimidating, especially when timelines, language, and outcomes are difficult to understand. And we do have resources in place to buffer this. Parents who are involved in circuit court for child welfare cases do have their own counsel. My impressions from talking to families that are involved with these cases is that a lot of people do not have sufficient time with their counsel or really an understanding of the proceedings sufficient to really participate in their own defense. Mandated services, so things that are court ordered. Required participation in services may be experienced as coercive or overwhelming when choice and our autonomy are limited. Loss of autonomy itself, having little control, can increase stress and feelings of helplessness. Loss of privacy, sharing personal information across systems can feel intrusive and unsafe. And loss of voice, feeling unheard or unable to influence decisions can reduce trust and engagement. And in fact, when I did a lot of parental fitness evaluations, I had many parents who told me that that was the first time anyone had really heard their side from start to finish. Not having that ability when you are having a lot of things happen to you that you don't have agency with, it can be traumatic for people. How trauma or traumatic reactions can look is going to be different depending on the age of the person. So in early childhood, we may see attachment disruption. That can take regressions in early development, things that a child's already moved past. They may start showing those behaviors again. Heightened stress responses, a lot of somatic complaints can happen in early childhood. School-age children may have academic disruption, may not be able to focus at school if things are going on at home, may have difficulty trusting adults. In adolescence, you see struggles with their own autonomy and potentially mistrust of authority. Adults also exhibit trauma responses to different things that may be triggered by child welfare involvement, the different aspects that we already reviewed. And a lot of times these can look like aggression or disengagement. These can be misinterpreted by folks interacting with the adult. So some things we may see when we have a family that's having a high acuity CPS case: hypervigilance, constantly scanning for risk or threat, especially during interactions with authority or systems; avoidance, delaying, missing, or withdrawing from services that feel overwhelming or unsafe; emotional numbing, appearing detached, flat, or indifferent as a way to manage intense feelings; distrust of systems, expecting judgment, punishment, or loss rather than support based on past experiences. I would say that's the one that seems to stand out as causing a major source of conflict between a respondent parent and the professionals that are trying to help them with their case. Similarly, difficulty with authority, having strong reactions to perceived control, monitoring, or power imbalance; and survival-based decision-making, prioritizing short-term safety or relief over long-term planning, doing things that seem counterproductive or not in their family's best interest. How trauma becomes intergenerational. So how does it get passed down within families that are involved with CPS? One way is through relationships. Early disruptions in caregiving and attachment can shape how individuals experience closeness, how they trust helpers, and how they even parent their own children. Through chronic stress, repeated exposure to fear, uncertainty, and loss can recalibrate stress responses, making the world feel unsafe. And oxidative stress in our body can affect how our genes express themselves. Through systems exposure, ongoing involvement with child welfare courts, schools, and other systems can reinforce expectations of surveillance and punishment across generations. I think probably most of us on this call who have worked closely with these families can relate to when a family has had multiple episodes of child welfare involvement, how kids change from year to year. So they may be explicitly coached, or they may learn on their own not to talk to CPS, not to let people know what's going on in the household, not to ask for help. And those changes occur through repeated exposure to the systems themselves. Through learned survival strategies, coping behaviors that help someone get through earlier system involvement may be reused later, even when they are counterproductive in new situations. I used to see that a lot, where perhaps at one time a family was able to avoid what they saw as adverse consequences by not being truthful or by, hiding information or not communicating well. And then there's a case with a different set of allegations, different worker, maybe it gets escalated to court this time. And those same behaviors that worked with the previous case end up getting them in more trouble in a newer case. And a lot of times those things that are seen as non-compliant are not always seen as what they are, which is often survival strategies, ways of dealing with a previous trauma. Through cumulative disadvantage, so child welfare involvement often overlaps with poverty, housing instability, parental substance use, and limited access to supportive services. So trauma can be kind of reiterated between generations because of these other factors that go along with it. And through limited opportunities for repair. So often there are a lot of resources invested into investigation and kind of support phases of CPS cases. And for a lot of reasons, there is not as much emphasis on what do we do post reunification to make sure that this family is not going to be in the same situation a year from now, 2 years from now. And that includes with families that have older children who are able to understand the situation, having sufficient repair of some of the trust that can be damaged during the pendency of a case. How systems can actually reinforce this trauma within families. So ongoing oversight can heighten fear and hypervigilance, especially for individuals with prior child welfare involvement. So people can have a CPS referral for lots of different reasons. Sometimes it's for a misunderstanding, or sometimes there's a situation where the child is safe, but there may be visible cause for concern, such as a bruise or an injury. So a lot of different people can come to CPS's attention, but someone who's never had any CPS involvement before versus someone who was removed from their home as a child, like they may have very different reactions to someone coming into their home and questioning them because of past trauma. Escalation from support to compliance. There is a shift in services. Initially, they may be supportive, but as we get court involvement, there can be a focus more on compliance or enforcement of court orders, for example, family case plans. And individuals may disengage or become guarded to protect themselves. So in an ideal case, parents are compliant, and we typically see that as a good thing. We tend to reward compliance in these kind of cases, but not everyone has the ability to emotionally regulation, feel safe, and do that. With fragmented systems, multiple agencies have different expectations, which can increase confusion, stress, and risk of miscommunication. And often the person who's kind of in the lowest power seat among all these different agencies can be the parent. Their voice is not always taken as seriously as everyone else's, and can make it very difficult for them to navigate these systems if they don't communicate effectively within, among one another. High stakes consequences. So things such as a drug test, for example, can affect custody, placement, other legal outcomes. And so this high stakes can intensify stress responses and limit thoughtful engagement. So if parent is really working from this survival response as opposed to having other parts of their brain engaged where they can think things through, then they may be very reactive in making poor decisions. There can be limited opportunity for repair. As we said, just as within families, there can be limited opportunity for repair. There can be limited opportunities for repair because of how stakes each individual task is. And cumulative exposure across generations. So repeated involvement over time can reinforce expectations of surveillance and punishment within families. Families learn to distrust CPS or other aspects of the system, and that shapes their behavior. Okay, so we talked about these adult trauma responses, and I want to talk about how they can look. So we probably have all seen these terms in the white circle or even used them ourselves when describing parents involved with child welfare cases: non-compliant, resistant, manipulative, unmotivated, inconsistent. And I want you to take a second to think about the terms on the flip side in the purple circle that perhaps from the parent's perspective, they may see themselves as avoiding danger, protecting themselves or their family, trying to regain control. They may be overwhelmed and they may be living in survival mode. What are ways that we can kind of break these cycles of intergenerational trauma? Reducing unnecessary system exposure, limiting monitoring, reporting, or escalation to what is truly required can lower cumulative stress and prevent re-traumatization. Prioritizing stability and continuity by maintaining consistent placements, providers, and plans of action, which reduces disruption and supports long-term safety. Supporting connection rather than separation. So when safe to do so, preserving relationships with caregivers, siblings, culture, and community wherever possible promotes healing and resilience. Kids need supports. It is one of the major resiliency factors in childhood is having even one supportive adult. And so maintaining contact with family, even if they're not placed with biological family, is extremely important. Addressing practical needs early, such as housing, transportation, childcare, and income stability. Stabilizing these factors reduces risk far more effectively than compliance-based interventions. Coordinating across systems, so aligning expectations, timelines, and messaging across agencies decreases confusion and contradictory demands. I love to see a really good MDT meeting where there is coordination and all the different agencies that are supporting the family are able to come together on expectations, particularly when we have parents involved in those discussions and their voice is actually taken seriously. And creating opportunities for repair, providing space for grief, loss, and healing after removals or investigations can help prevent trauma from carrying forward. So thinking about, so we've talked about this a little bit already, ways in which we can empower people who are involved in CPS cases, so giving them some role in decision making, reducing frequency of monitoring or observation to what is absolutely necessary, keeping services stable, and helping parents to be successful regardless of what we're asking them to do, providing support as opposed to looking through a compliance lens. So what are the types of things that can help families to recover? Protective factors in resilience in families that have experienced adversity. A priority is stable relationships. So for children, having at least one safe, consistent adult is a huge resiliency factor in predicting positive outcomes. We also want to look at positive peer connections and community connections. This was a really common recommendation for me for kids that were involved in child welfare cases. A lot of times, if they had to be removed from their parents' home, they did not have a lot of continuity in terms of like activities, sports, friendships they may have had at a different school. So maintaining any kind of connection that we can, or getting them involved in pro-social peer and community activities, particularly in more of a structured environment, if that's available to the family. Predictability is a huge one. So maintaining between households consistent routines, clear expectations, and timelines. Opportunities for success, school engagement, employment, meaningful roles in family and community. So for parents and children both, not just looking at the specific situation that was the reason for removal, but looking at what are things to help people be successful long term, helping them to be more involved in either child or adult social role functioning. It's really important. Hope and agency. So giving all family members a voice in decision making, being realistic about opportunities for change, and also each family member should be given access to support, whether that's behavioral health care, recovery support in case of someone who's using substances, and then practical assistance. In terms of giving a trauma-informed response in each of our different roles that we may have with these families, we want to prioritize safety, trustworthiness by being clear and transparent. I would say honest, not that any of us intend to be dishonest, but sometimes we can be misleading if we are trying to avoid conflict. Offering choice, offering options whenever possible. Collaborating with families, using a shared decision-making process when possible. Empowering families, focusing on their strengths and growth opportunities. And cultural humility, respecting family values and experiences. The times that I've seen, I'll give a specific example of this because it can be a little bit of an abstract concept, but for example, families with Native heritage, sometimes whether placement is a foster placement or a kinship placement, they may have opinions about like cutting hair, for example, or participating in certain culturally relevant activities. And we want to make sure that the family has a voice in that, and that we're not taking away a child's opportunity to participate in their culture. So from the different points of view that we have, how can we personally help to interrupt these cycles of trauma? Within the child welfare system, probably the most important things that can be done are to reduce unnecessary placement changes and to preserve relationships when safe. The court system can increase clarity and consistency of expectations, and reducing unnecessary delays is very important, trying to stick to those reasonable timeframes that we have as much as possible. Schools promote belonging and stability, and recognizing trauma-related behaviors. I think it can be helpful when schools are notified that there's been a change in placement or something going on at home. The healthcare system we can support by screening for trauma, supporting regulation and resilience, referring if there has not already been a behavioral health referral. And community organizations can help by providing practical support and connections. So I want to kind of quickly give just a fictitious case example, and then we'll see if we had one that was submitted on the fly, or if anyone has one that they want to talk about today after the presentation. All right. So I want to think about a situation where a mother was removed from her own home as a child and experienced multiple foster placements, and then becomes subject of a child welfare investigation. As an adult, she misses appointments, appears guarded, and becomes defensive when questioned. A traditional interpretation of her behavior may be that she is resistant, unmotivated, or non-compliant. Through a trauma-informed lens, we may reframe those as being hypervigilant, distrustful of systems, and attempting to protect herself from a perceived threat. So my question is, how might your approach to this parent change if you see her as hypervigilant, distrustful of systems, and protecting herself from perceived threat versus resistant, unmotivated, and non-compliant? And if anyone wants to unmute themselves and just chime in, how might you talk to her differently, behave differently, plan things differently? What do we think?
This is Deb. One of the things that served me well over the years is doing what I say I'm going to do.
Mm-hmm.
I'm going to call back on Thursday, call back on Thursday, whatever the thing is. That I believe has helped me.
Yeah, that's a huge one, because what you're doing is you are establishing trust. So these are folks that have had trust broken either on purpose or not on purpose, either by their own family or by the system. For whatever reason, trust has been broken for them. So the more that we can follow through on what we say, the better. Absolutely. Any other thoughts on how we could support someone like this?
Yeah, I think that trauma-informed interpretation really helps us cultivate compassion and empathy versus being in the punitive frame of mind, where we are perceiving someone as resistant, unmotivated, or compliant, like they don't really want their kid back. So, they can suffer the consequences versus they are struggling given their personal history and experiences.
Yeah, as a psychologist, if I think about those two different frames, the prior one, what do I even work with her on? If she doesn't want to work with me, she's resistant, she's not motivated, she's non-compliant, that does not make me want to exert any effort in helping her or the family. Whereas if I'm thinking of this more as a survival response, she's acting this way towards me because she's afraid, then my focus goes on, how do I help her to trust me? Any other thoughts?
You had a comment in the chat that said, doing what you say you're going to do is big.
Mm-hmm. Absolutely. When I was talking before about how one of the kind of things that we do as a system that unnecessarily reinforces the trauma is with causing confusion, by having different different expectations, different providers saying different things. Something's ordered at time one, then it's changed at time two. The confusion is it makes it very difficult for people to think clearly and then predict and act reliably with their own behavior, even if they have good intentions. And so I think we can relieve one source of that by we are consistent, regardless of if they're getting mixed messaging from other sources. If we are consistent, then that allows them to relax and engage that frontal lobe and be more intentional with us.
Yeah, I just wanted to offer my own experience of working with individuals who perceive their child protective services worker as an ally versus an enemy. And one of the cases I'm thinking of includes this individual actually had their rights terminated eventually, but it didn't necessarily change their perception of that caseworker. They had multiple caseworkers, but one of them was what they perceived as an ally, and just this sort of softening that allowed her to do, versus this idea of being in fight or flight, and feeling like they have to defend and therefore not always be truthful because that what they say will be twisted, or just the fears that go into that trauma response to a worker versus like this person actually understands and wants the best thing for me and my kids. Very different. It that in itself can help with having a trauma-informed experience.
Yeah. And it's very easy for me to say from, the privilege of my safe office, what should a parent do if they're involved with CPS is put your head down, focus, do exactly what they say, follow the rules, and you're going to be fine. But that is easy for me to say. It is a lot harder to do that if you yourself are dysregulated, if you've never seen any role models of situations where people did comply with CPS and it worked out well, like if you have no frame of reference for that working and your whole body is telling you you need to defend yourself against this, perceived threat, it can be, it's a lot, what we ask of people is a lot harder than I think we realize.
There was a comment in the chat that said, help her make responsible decisions that she feels is needed, and explaining things to her with the understanding that she does need to try. This gives her control, trust, and feeling that we are there to assist.
Absolutely. I think people need to feel that their voice is carrying some weight in this situation. It is all about their family, if we're going to be real, like, and we really should be, but they need to feel that we're listening. So I think having that kind of back and forth where we're looking at almost like a motivational interviewing approach, like what does she think she needs, and how what we're asking her to do, how does that help her get what she needs? How can we come together and find some common ground? Super important. All right, so we're kind of at quarter till. Anyone on the call, if you ever this down the road sparks any questions and you think, oh, I need to ask this girl out or whatever, feel free to reach out to me at any time. Laura always knows how to get a hold of me. But with that, thanks everybody, and we'll go on to the rest of the echo.